My narrative along this process started here in 1973, I guess it was, because that's when he created managed care. He signed into law the HMO Act, creating managed care. And that was part of why I decided to go to medical school. I thought that was a terrific idea. The concept that appealed to me about that, and probably appeals to some of you all, is the idea, pay doctors a certain amount, and if we can keep you healthy, great, and then we can actually make more money from keeping you healthy. Or if we neglect you or do crazy things and make you get sick and have problems, well, we bear the financial risk for that. So I thought that was brilliant. That means that we would have money in the game of keeping you all healthy. I thought that was terrific. That's part of why I went to medical school. And I stayed within the managed care structure for 39 years or something like that. But little by little, things started to happen that have accumulated and sort of changed my point of view pretty dramatically. So I'll tell you the first of these stories. It's about a patient. So I was running a medical group in Chicago. It was a great medical group. It was what's called a staff model HMO anchor. And we were paid just like I described. We were paid a certain amount. And if we could keep you healthy, then we made more money. If we screwed up, we lost money, and we actually were able to do it pretty well. So there was one office of our 10, I think, that we had that was the best office. If you had an opening, you got a colonoscopy. If you needed a mammogram, you got everything preventive we could think of. It was great at that. Our patients loved it, and indeed, with all of this great preventive healthcare that we were doing, we made money. It was profitable. And then this one guy came in. Nope, there he is. It's not actually him. I don't have a picture from 1970, whatever. But that's this one guy. He had hemophilia. So what? So hemophilia is a condition where you don't form clots, where you tend to bleed more. And it turns out it's incredibly treatable. And so treating him was something that, of course, we had to do at the cost of $1 million a year. That's what it cost, and probably it's way more than that now, but $1 million a year to treat this one guy. Well, this little office into which he went, they couldn't pay for that. They didn't have that kind of money. If we didn't come up with some other solution, they would have gone bankrupt. That clinic would have had to close. And so we didn't act on it, but what dawned on me as the medical director there was, despite all of those vaccinations we gave, no matter what you think about that, despite all of the preventive care that we did, this guy, by himself, taking care of him, could close our office down. And so what we should really do, from a business perspective, we should make him not like us. We should start being a little more rude to him. We should call him by his first name if he doesn't like that. We should not answer the phone quite, put him on hold more. We should do things to make him stop really wanting to come to us. We didn't do that. We figured out another solution, but it really ate at me that the business imperative on my medical group was to make a patient not want to see us. That can't be the right way to set it up. So things like that kind of accumulated, and more experiences. And that particular story, turns out it's an old story in my life, but it turns out it's incredibly current. That's still exactly the dynamic that insurance companies have today. And to prove that to you, here's a current ad. Have you seen this ad? It's an ad for an insurance company called Everest. So like, Mount Everest, and it's got these people that are doing whatever it is that they're doing. So it's an ad that seems like it's to attract, healthy people, So if you unpack their ad, if you look closely at it, there's actually in fine print a list of things that aren't covered. And I swear to God, I'm not making this up. It doesn't cover mountain climbing.